In the realm of mental health, the DSM-5-TR and the ICD-11 stand as twin pillars of knowledge, yet they are as different as they are alike. Welcome to a journey of understanding these essential tools of mental health diagnosis. The Diagnostic and Statistical Manual, or DSM-5-TR, is an American invention, a product of the American Psychiatric Association. It is a compendium of mental disorders, each meticulously defined and categorized. The International Classification of Diseases, or ICD-11, on the other hand, is a global endeavor, crafted by the World Health Organization. It covers all diseases, not just mental ones. Each of these tools has its strengths. The DSM-5-TR, with its focus on mental health, offers a depth of detail that the ICD-11 can't match. It provides precise diagnostic criteria for each disorder, making it a valuable aid to clinicians. Moreover, it is updated regularly, ensuring that it remains current with the latest research. The ICD-11, however, boasts a breadth of coverage that the DSM-5-TR can't compete with. It is a comprehensive guide to all diseases, making it a useful tool for a broad range of health professionals. It is also more universally recognized, accepted by insurance companies and medical institutions around the world. But these strengths also hint at their weaknesses. The DSM-5-TR's focus on mental health can be a limitation. It doesn't cover physical diseases, which can be a handicap in cases where mental and physical conditions overlap. Furthermore, its American origin means it may not fully reflect the diversity of mental health experiences worldwide. The ICD-11, meanwhile, can be overwhelming in its scope. Its broad coverage can make it harder to find specific mental health information. And while it is universally recognized, it is also subject to political pressures that can influence its contents. So, which one is better? That's like asking whether a microscope is better than a telescope. They are different tools for different tasks. The DSM-5-TR gives you a close-up view of mental disorders, while the ICD-11 gives you a panoramic view of all diseases. Each has its place in the toolkit of mental health professionals. And that brings us to the end of our journey. We hope this has shed some light on the intriguing world of mental health diagnosis. If you found this video helpful, please subscribe to our channel. We have many more insightful videos lined up for you. Thank you for your time, and remember, understanding is the first step to compassion. Both the ICD and DSM are used by a variety of professionals in the mental health field. Psychiatrists, psychologists, social workers, and other mental health professionals use these tools for diagnosis and treatment. But it's not just them. Insurance companies also use them for billing purposes. They are used to categorize conditions for coverage and reimbursement. And let's not forget the researchers. They use them to ensure consistency in their studies, making sure that everyone is on the same page when they talk about a particular mental disorder. So these tools are not just for clinicians, but also for researchers, insurance companies, and anyone else involved in mental health care. Let's dive a little deeper into who exactly uses these diagnostic tools in the mental health field. While both psychiatrists and psychologists work in the mental health field, there are key differences between them. Psychiatrists are medical doctors who have the ability to prescribe medication. They often focus on treating mental illness with a medical approach. On the other hand, psychologists focus on psychotherapy and treating emotional and mental suffering with behavioral intervention, not medication. Both can use the DSM and ICD for diagnosis, but their treatment approaches may differ. So while both professions are crucial in mental health care, their roles and approaches can be quite different, adding another layer to the complexity of mental health treatment and diagnosis. In our previous discussion, we focused on how psychiatrists and psychologists use the ICD and DSM. However, the use of these diagnostic tools extends far beyond these two professions. Other mental health professionals, such as social workers, also utilize these tools for diagnosis and treatment planning. Furthermore, these diagnostic manuals are not confined to clinical settings. Insurance companies, for instance, also rely on them. They use the DSM and ICD to categorize mental health conditions for coverage and reimbursement purposes. This ensures that the cost of mental health care is accurately accounted for, and that patients receive the financial support they need. In addition, researchers also use these manuals. They ensure consistency in studies and provide a common language for everyone in the field. When a researcher refers to a specific mental disorder, everyone else in the field understands exactly what they're talking about thanks to the DSM and ICD. So, while these tools were initially developed for clinicians, their use has expanded significantly. Today, they serve a crucial role not just in mental health care, but also in research, insurance, and various other aspects of our society that intersect with mental health. As we delve deeper into the mental health field, it's important to understand the key differences between the professionals who use these diagnostic tools, particularly psychiatrists and psychologists. Both are integral to mental health care, but their roles and approaches can vary significantly. Firstly, psychiatrists are medical doctors who have completed both medical school and a residency in psychiatry. They can prescribe medication and often focus on the medical approach to mental health. They use the DSM and ICD to diagnose mental disorders and determine the best medication or other biological treatments for their patients. On the other hand, psychologists typically hold a doctoral degree in psychology and focus more on psychotherapy and behavioral interventions. They use these diagnostic tools to understand their patients' thoughts, emotions, and behaviors, and to develop a comprehensive treatment plan that often includes cognitive behavioral therapy, psychoanalysis, or other types of therapy. So, while both professions are crucial in mental health care, their roles and approaches can be quite different. This diversity adds another layer to the complexity of mental health treatment and diagnosis, and underscores the importance of these diagnostic tools in facilitating effective and targeted treatments.